This meeting is being recorded.
Well, good afternoon and welcome to our October Ranching One webinar presented by Ag Trust. Today, you'll hear from an industry expert and learn how to protect your herd health, reduce loss, and safeguard your ranch's long-term profitability. Before we start, please join me for a short message from Ag Trust.
When your passion is agriculture, and a rural way of life, you need a partner who understands. That partner is Ag Trust Farm Credit, formed from two trusted farm credit associations. Our mission is to provide personalized financing tailored for full and part-time farmers, ranchers, agribusinesses, and rural homeowners. And because we live in the communities we serve, Ag Trust Farm Credit is here to help you succeed.
Recognizing and responding to disease early is one of the most important skills a cattle producer can develop. Illness can quickly impact growth, reproduction, and overall herd performance, but timely detection and proper management can prevent major setbacks. Whether your goal is to limit the spread of a contagious disease, improve treatment success, or strengthen your herd's immune defenses, understanding the signs of illness and implementing effective herd health protocols is essential for protecting your cattle and your bottom line. We're excited to have Dr. Ross Thompson join us today as our guest speaker from Simmons and Harlan Vet Clinic in Wichita Falls. If you have any questions during the webinar, please submit them in the chat box or the Q&A box below. And at this time, I'd like to turn it over to Dr. Thompson.
That working?
Yes, you are good to go. I can see it.
Thank y'all for having me. Be pretty informal. If you have questions, I guess, like Brent said, type them in and we can answer as we go. Kind of a little background on our clinic and myself. We're a 5-doctor mixed animal practice in Wichita Falls. Mainly on the cow side, we're mostly cow calf. We do some stock or background and consulting as well. Do a feed yard or two here and there. Also do sale barn work at the Wichita livestock here. We do quite a bit of equine reproduction in the spring, some lameness stuff, and then small animal mixed in as well. Me personally, my family has a cow calf operation in Breckenridge, and then I run some yearlings up here around Wichita. So kind of today, I guess what we're going to talk about is herd health, biosecurity, and then what to expect on treatment success, and try to understand some of the disease processes to know what you're treating and whether or not your treatment's working. And then we can kind of go through how to maybe come up with a health protocol. And if y'all have questions, just let us know throughout. All right. Kind of a new, or not a new thing, but a bigger topic, especially here lately with the antibiotic prescription requirements coming out, is a vet client patient relationship. Very important, I think, as producers to have a good relationship with a veterinarian, especially locally if possible. They're going to understand your operation the best, your needs, your wants, and we all understand not every operation is the same. Everybody's different. Everybody does things a little different, and be able to take those into consideration. like I said, it's required now for all antibiotics prescribed. And if you do any, you feed any CTC or Rumensin or anything, a VFD is required. And so legally, on our standpoint, we have to see something of yours once a year to be able to sign those scripts. So I think the easiest way, is to have a meeting with your vet and kind of get a herd health plan set up, treatment protocols, vaccinations, deworming, when you're going to preg, or how your year is going to look. And I think let your vet take a look at it and kind of see if there's ways to improve it or or whatnot. Uh, so on the herd health, biosecurity, like I said, everybody's different. Everybody's got a different type of operation. Some people don't move a lot of cattle. Some people are having cattle arrive every day. So we're going to take those into consideration. Facilities, what you're capable of, as well as the capability of your employees. There's places that have people that, unfortunately, they have a certain limitation on what they can do every day, and that's to be expected and different on each operation. Location, weather obviously play a big role. Nutrition, I think it's always good to have a nutritionist on board as well, especially if you're doing any sort of feeding. Um, and then one thing a lot of people don't think about is, your neighbors. You may do everything perfect, but you may have a big disease outbreak next door. A lot of times, not something we can control, but it's something that can be managed. Uh, and that kind of comes into biosecurity. So if you are having new cattle on arrival, are you just dumping them out into the herd, or are you quarantining them? What's the risk level? Where did these cattle come from? Age, stress, have they been weaned, etc. One thing that I'm seeing become a lot more prevalent is people wanting to do disease testing on some, whether it be mama cows or yearlings coming into a herd. Um, Anymore, it's required to trick test a bull before sale if they're 18 months or older. Uh, I always say don't trust everybody on, if they claim it's a virgin, who's to say it didn't breed a cow through the neighbor's fence or jump the fence and breed a cow and then come back. Or you don't know the history of that bull as well as you think you did. Um, Trick is not something that I recommend ever fooling with. And we've had some outbreaks up here in the last year or two, and they can turn into a wreck pretty quick, uh, especially financially. Um, Another thing I've seen lately is some anaplas. We'll kind of get into all these diseases later on, but uh, some people are wanting to test some cattle for anaplas before they put them into the herd. Never wrong, just a blood test, pretty easy to do, and it's something that some producers can even do, and we can, your vet can send them off. Uh, One disease we kind of don't think about a lot, I just kind of dealt with lately, is Yonis. Yonis is it's a disease that a cow gets from their mother typically, and it takes it lives in their body 5 to 6 years before it shows its teeth, and then typically you see a middle to older age cow with chronic diarrhea, weight loss, and they will. There's no treatment, and so we had an operation locally that we found he was having trouble with some older cows that were getting diarrhea and getting real thin and poor. And so we figured out it was Yonis. That went through and tested the whole herd and found a lot of cattle that were floating around that didn't have clinical signs yet, but it's good to get rid of those before it became a bigger problem. BVD, we see a lot more yearling guys wanting to test for PI calves, which is I think some of the wrecks we run into. Um, Consult on, there typically will find a PI calf or two in there, that will sure bring the herd health down on that aspect. Uh, Up here we had a lot of rain this year, and it's been a great summer, but the flies have thrived, and so pink eye uh, is something that we dealt with pretty hard. And then your typical VRD. And then another thing a lot of people don't think about is coccidiosis and stressed calves that are in a feed pen setting. Um, some ways we can kind of control some of the biosecurity besides testing, vaccination, processing, metaphylaxis treatment. Um, One that a lot of people don't think about are fomites, which is a word that basically just means an object that can transfer the disease. So whether it be a cattle pot, uh, you know, cow poop on your boots, anything you can. One thing that worries me about is when I'm palpating cows, if I get blood on my sleeve, if that cow were to have anaplasm and I rectal, another cow, I could potentially transmit anaplasm to that cow. Um, Blood on needles. That's kind of what a fomite is. So those are kind of things to take into consideration, uh, on that aspect. And then the pins, bunks, water, especially when you're looking at uh, coccidia. It's a protozoan that causes bloody scours. We'll go into that later. But I see that a lot in kind of dirty, muddy pens that are overcrowded. And then good fences. Good fences make good neighbors. But that's key to your biosecurity of your herd. As I said, you can do everything right, but if your neighbor's not and his cows are in your or bulls in your pasture every day, uh, we get the
Ross, are you still there? I think you're glitching out. I think we
Is
are
it?
having some. Oh, Ross, are you still there?
Yep.
Oh, there we are. I think we're having some technical difficulties. Can you still see your presentation?
I can. Can y'all?
I think it stopped sharing on your end, if you don't mind sharing it again.
You bet. Is that back on?
Yes, we are back on. I can see it on your end now. Okay.
Okay. So yeah, given the vaccine and medication correctly, whether it's the needle size, is it supposed to be IM sub Q? Uh, I like 5/8 inch needle if it's sub Q, inch if it's supposed to be IM or inch and a half, to get it down to the muscle. Um, One thing we look at is different types of needles, whether it's a beveled or an angled needle. Beveled are supposed to cut, angles are stab, and so what heals quicker, a stab or a stab or a slice, uh, and that will prevent. Are you gonna leak out vaccine? Obviously, it doesn't do no good on the side of a cow, um, and so whatever works best for you. Try different needles if you're having problems with it leaking out. Um, and then, are you treating the right diagnosis? Sometimes we'll see uh, stuff that's not responding to treatment, and we're treating the wrong thing. Sometimes that plays a role into why the medicine isn't working. Uh, Kind of similar. Where am I giving the injection? We did a producer meeting not too long ago on injection sites and different needle sizes and how to administer medication. Um, and I think it was really beneficial, even, guys that run several thousand yearlings, there's always ways to improve. One thing I found interesting is, you see this picture of the cow, the triangles, obviously where we want to give the medication, but some things to think about. A lot of times you're reaching over a bar as a chute, and if you get in the top of the neck, sometimes you'll give it in that nuchal ligament, and there's no blood flow there. So if you give a injection or a vaccine of any sort there, it's just going to sit there. The body has no way of picking it up. That's that kind of tough ligament on the top of their neck, and basically it helps lift their head up and down to graze. But there's no blood flow in that ligament, and it's a good 3-inch diameter ligament. So if you're injecting a medication or vaccine there, you better same thing as shooting it on the side of the animal. It's not going to be absorbed. Um, and then if you're given multiple shots on the same side, are you giving them horizontally or vertically or on top of each other? Because a lot of these, especially vaccines, you give them in the same place. Or if gravity pulls the vaccine down into the other vaccine, you're going to get some cross reactivity, and you're probably going to negate uh, what you just gave. So I always recommend giving them horizontally, and at least a couple inches apart if you can, so that we don't have that sort of cross reactivity and basically null out what you just gave. Um, Another thing to think about, is the spinal cord or the jugular. Obviously, you don't want to give medication there on the bottom aspect. Um, One kind of interesting um, study that I saw lately, I think Merck did it, that on dragging calves when we're branding, a lot of people will give a calf a vaccine there in the armpit when the flankers got it pulled up, uh, which is sub-Q, but does it absorb as normally as it would in the neck there? They injected a bunch of calves and then posted them, and a lot of them found kind of the body kind of walled off the vaccine there in the armpit. Um, not all of them obviously, but some of them. And so are you, every calf, are they absorbing the vaccine there? I always say if you can give it in the neck, that's where all the studies on the vaccine go, and it works there. Dart guns are another kind of topic. I use one. I think they're a tool, um, obviously, and a good tool at that. But you have to think about, if you're giving an injection that needs to go uh, sub Q, and you have all this power behind this dart, it's typically jamming the needle uh, into the muscle. So I always say the shortest needle you can use on a dart gun uh, is the best, because a lot of times you'll end up giving that medication IM, and a lot of times that's when we get the knots, is when it's given improperly. I think I got pictures of some of that from our lab we did producer meeting. Um, basically we had a excuse me, couple chronics that we gathered up, and we gave some medications improperly, and then um, euthanized animals, and kind of walked through with some producers on what happens when we really give it. On the left, everybody's seen a bottle of LA 300 sitting on somebody's dashboard of their truck in the sun. It's been riding around there for a couple years. Uh, and it gets kind of that grit and turns real black. It's not going to do anything, and it's just going to make a big mess. That we gave that calf some kind of gritty, nasty LA 300. You can't expect uh, the medication to work if it's not been stored properly. So store your medications, how they're meant to be on the label. Um, if you want the best success out of the medication. Um, and the other two are medications that, Banamine IV is the best way to give it. In the muscle, it's a big irritant. That was, I think, 10 cc's of Banamine we gave with a 14 gauge 2-inch needle. You can see what it kind of trauma it caused to the muscle there. And then same with the multi-min, it kind of made a nasty gangrenous abscess there. So you can assume that medication wasn't absorbed normally, and actually the animal actually responded to the medication. One thing we also kind of look at is why isn't it working? What's your syringe gun protocol look like? A lot of people don't know this, but disinfectants are going to damage your vaccine, especially chlorohex, alcohol, especially the modified live vaccines. That's a pretty fragile vaccine, and if you soak your gun in alcohol and then pull up vaccine, you're going to have alcohol in there that's going to basically stabilize the vaccine so that you don't get a good immune response from it. I think the best way is just to boil your syringes when you're done with them, and then keep them in a Ziploc bag, somewhere clean. Another thing we look at, we've all got, how many times did you stab the bottle of vaccine or medicine? And when you did, what kind of needle? It does the needle one that was dropped in the dirt, and then you reintroduced all that into the bottle of medicine, and then you're going to draw it up and put it in another cow. You're asking for an abscess or it to cross react with the medication. Same with, a lot of bottles will have a limit on how many times you can stab them. I mean, tilt over a bottle of vaccine and it starts dripping out. It's probably contaminated pretty significantly. And then on the vaccine side, it's something you can talk with your vet about. What fits your operation? Is a modified live or a killed vaccine more appropriate for what you plan to do? Now we'll kind of go into some basic diseases and disease processes. Sorry, I don't know why that keeps coming up, but pink eye is, like I said, one we dealt with a lot this year. Got a lot of calls about it. Basically, some sort of trauma to the eye starts the process. The bacteria is Moraxella bovis. Mostly what you'll see is a overly watered eye, or cattle walking around squinting out of it. Things that can cause trauma to the eye: flies, brushy pastures, chemicals. One thing took me a while to think about, and I had a drug rep kind of show me. It kind of interested me, was ear tags. Where are we putting ear tags in our cattle? Are they big enough and close enough to the eye that when they switch their ear, their tag hits their eye? Over time, that's going to cause irritation and scratching of the cornea. which would introduce pink eye. There's some kind of pictures of different levels of pink eye. Stage 1, 2, obviously, that's catching it early. Stage 3 and 4, giving a shot of Draxxin's probably not going to fix that animal. And then vaccine wise, there are, some pink eye vaccines out there, whether they'll work on your operation or not. I think that's, a $1 million question. I think that's something that you can sure look into if you're having a problem. They do make autogenous vaccines where they'll come out and culture what's growing on your cattle's eye and make a vaccine. Some people love that. Some people think it's voodoo. Another one we saw a lot with the rain, moisture is foot rot. Foot rot there has to be some sort of trauma to the interdigital space to start the process, similar to pink eye. Foot rot normally comes from fusobacterium, which is normal bacteria to the cow. It's in their poop, it's in their mouth. And so there has to be some sort of trauma most commonly, standing in water, standing in a tank, mud, tight pins, and that, like us, if we get in the pool and our hands start pruning, cattle's feet will start, the skin will get soft, and then that bacteria introduces into there and causes the infection. When we're looking at cattle lameness, 90% of lameness is in the foot, but it's not always. A lot of times what we'll see is, hey, we gave them 4 shots of antibiotics for pink eye or for foot rot, and we're still limping. Well, that's going to be something other than foot rot. If you've given one round I always tell people, if you've given one round of macrolide, like Draxxin's, Prevo, something labeled for foot rot, and we're not getting any improvement, then something else is going on. On the left, that's kind of a picture of a bull I saw this summer that started with foot rot. It wasn't treated in time, and the bacteria actually got into the joint of that bull and caused a joint infection, which is very hard to treat. Treating systemically with a shot of antibiotics is not gonna fix that animal. So we could do stuff like we can do an ankylosis where we drill out the joint, or there we have a tourniquet. We're putting antibiotics into the vein and letting it soak through that foot for 10 minutes with a regional limb perfusion. So there's different ways, to treat those and get a better response than just a shot. And a lot of times, if you give a shot and it doesn't respond, then that's something that we can look to do to improve your success rate. Also see a lot of people, a lot of animals that are thought to have foot rot and they have torn ACLs, all sorts of soft tissue injuries that might not be infectious at all. And so that's kind of where my rule of thumb, if you have a limping animal you think's foot rot and you give a macrolide, it doesn't work, then probably something else going on. It'd be good to have your local vet take a look. All right. Scours. Scours is a kind of a hot topic this time of year. There's a lot of different things that can cause scours. Mostly see it in calves. Bacterial, viral, protozoan, parasitic. Most common is coccidia. Very rare to see coccidia in an older animal. Usually it's your younger wean calves. Something with some stress going on. Typically a healthy cow immune system will get rid of coccidia. Coccidia is a fecal oral transmission, and so you'll have cows or calves that are carriers, and they'll defecate into a set of pens, and then the next calf will go around and smell the ground and then inhale the egg, which is what that picture is. Those are coccidia eggs. Um, Different sorts of coccidia stats you can put in feed, or treat the water with Corid or an amprolium product. The best is hygiene, keeping pens and waters clean. Uh, Something I think underutilized. And you can use with your vet as a fecal test. All you need to bring is a stool samples, and we can spin it down, look on a microscope. 15 minutes tell you coccidia or parasite load. Um, or if there's not that, we can send off a culture or PCR, see if you have salmonella or some sort of viral disease process going on. Another aspect fecal testing, is your deworming protocol working. Uh, you know, Grab a few samples out of the pens, before you deworm them. Let's look at those and then de- deworm. Um, and help figure out if you're doing for.
Hey Ross, I think your presentation stopped sharing again.
Sorry, our
No, you're okay.
computers.
We're good to go. I can see it.
All right. Well, I don't know. It's when I lost BRD. Let's see. There we go. Okay. So yeah, BRD. Is it a viral, bacterial, or both? I think a lot of them, I see start with a viral insult and then bacteria takes over quickly. I think the biggest, deal with managing BRD is how you handle the stress level on the animal or the level of risk. I think that's the biggest thing we run into when we're posting calves is we given everything, nothing's working. Well, I think it all goes back to how was this how was everything set up in the beginning? Was the vaccine given properly? How are the cattle managed? What was the weather like? Where did these animals come from? Were they weaned? See a lot of issues with PI testing. A lot of people around here have gone to PI testing, and seen really good responses with that. It's another expense, obviously, but I do think it pays off in the long run. And it is something you can do shoot side. They have little snap tests, or you can get a ear notch and send it to the lab and have results back pretty quick. Um, and then I think easiest is, prevention is get your veterinary involved early. If you're, it's hard for us when we come in into a place that's already got a 40% death loss and the wreck's been going on for a month, to come in and fix things. But if you start having trouble early, I think it's good to get your vet involved early to try and prevent a wreck as best we can before it happens. I hear a lot of people say that you can't. Necropsy obviously has to be done pretty quickly, usually same day as the animal passing away, and I can't get my vet out there. Most veterinarians are, we have that meeting to try and teach some guys how to necropsy themselves. And they can take the lung out and bring in samples, and we can look at it and send it off, uh, or text pictures, because we can't be everywhere at one time. Obviously, nobody can. But it's easy to cut open a rib cage with a set of tree trimmers and uh, get a sample of lung out and bring it to the clinic, and we can look at it and send it off. Um, and I think that's the best. Most of it comes back to the management aspect, and getting on top of it early rather than trying to clean up late. Uh, Anaplasmosis is a disease that it's a bacterial disease. You see it a lot more commonly. I'm sure there's people in the South and East Texas on here. We do run into it in North Texas. It's a bacterial disease that basically causes the cow to lyse their blood, which just destroys their blood. It most commonly transmitted ticks, flies. But like I said earlier, there is, get blood on a needle, palpation sleeves, any sort of blood contamination can sure uh, give anaplasm from one cow to another. It's not a disease you'll see in calves. Typically, you see it in cattle at least 2 years old. Most commonly, you'll see it in cows that are off by themselves, kind of weak. Sometimes, if you can look in their eyelids or their vulva, they'll either be real pale or have a jaundiced tone to their mucous membranes. A lot of times around here, we see anaplastic cows have a really strong change in demeanor. It'll be a cow that used to come eat basically right off the flatbed cake truck, and now they're trying to run you around the truck. And a lot of that's just due to the anemia. There's not a lot of oxygen transported to the brain, and they kind of get starved down on oxygen, and that's how a lot of these cattle die, is lack of oxygen. Their blood, they don't have any blood to carry oxygen. They get real worked up, stressed, and pass, unfortunately. Really easy way is just to do a simple blood test. You can do a blood smear and look at it under a microscope. Sometimes I'm not good enough to do that, so we usually send them into the lab for a PCR test to detect anaplasm. Tetracyclines are going to be what you treat with, whether it be injection or you can feed CTC mineral or CTC in the feed as kind of a prevention and treatment aspect. That comes with that. There is a prescription required for that now on the veterinary feed directives. There are anaplasm vaccines. I know LSU makes one. I think there's some autogenous. That'd be something if you're interested to talk to your vet about, whether it would be worthwhile. I have no experience with it, but I know a lot of places in Southeast Texas, Louisiana use them because they deal with it a lot more. Going back, I think, ways vets can help you come up with treatment protocols. Consultations, fecal testing is underutilized. Disease detection, prevention. We can offer a lot more than just the normal stuff you think about. A lot of guys, why is my weaning percentage lower than normal? Why is my calf crop lower? That's when we could start diving into stuff and really helping you rather than telling your cows open and moving on. So I think, get with your main takeaway, get with your local vet and to get a relationship with them if you don't have one. They're there to help you. They want to help you and try to make your business the most profitable it can be and successful it can be. That I think is what I got any questions out there?
Yeah, at this time, if you have any questions, feel free to drop them in the chat box or the Q&A box below, and I can ask those. Okay, so this is a multiple question, so I'll try to break it up for you. We are on a small farm, 20 cows south of San Antonio. Question 1, we leave out block. Oh, you got it pulled up, actually. We leave out block
no,
or
I
bloat
didn't.
guard year round. Is that okay or not okay?
Yeah, I think that's fine. I know down there. I did an internship in Floresville that a lot of it's in the winter. I was there in the winter. It seemed like there was a lot of magnesium deficiency in that soil, which is not something we have in North Texas. But I think those bloat blocks, mineral blocks, those are great to leave out year round. I think you should get a good success rate with that. And if you're not, may look at some soil sampling if you need to supplement a different mineral or different aspect into a feed or a block would be kind of how I would go about that.
We also leave out mineral lick tub with fly killer year round. Is that okay or not okay?
Yeah, that's great. Different types of fly repellents and minerals, whether IGRs. I think I would make sure that it's science backed. I mean, there's a lot of different fly repellents out there. Garlic and also, I've heard of essential oils and stuff like that. I kind of lean more on the science-based medicine in that aspect, but year round is fine. Most of those minerals, if a cattle eats too much of it, they usually I
Oh, are you still there? I think you're glitching out.
do what?
Oh, there you are. Sorry, you're glitching out a little bit. Now I can hear you.
Oh, okay. I have seen some weed pack come from out east that were low in calcium. These guys were roping them and they were breaking legs on them. And so I think mineral is a really good aspect to the health of the animal. And I don't most of them you can't overdo. But, you worry about the cow that sits there and just chows down on mineral. Obviously, financially, that's harder than most, but I think year round is perfectly fine.
Does pyrethene spray help prevent screwworm fly? Yes, no, maybe.
It should. It should. The screwworm is an interesting topic, but it will, as far as be a fly repellent, fly treatment, just like any normal fly. I think any of the pyrethrins are probably the best fly spray we have out there. That works best. There are some different medications that are going through the FDA to get labeled for screwworm prevention. That if it does get into Texas, I think the approval will come sooner than later, hopefully. But I think there'll be good tools out there, as well as pyrethrins. I know there was a Dectomax that got labeled a week or so ago that I think is 40 days of prevention on screwworms. So flies, pyrethrins or something like that would be fine. There are some medications they're using in Brazil that I don't know if they're going to get approved or not, but I know they're looking into that as well. So I think if it does show its teeth, we'll have some tools to fight it.
What about garlic mineral block helping to prevent flies?
That's one that I lean more on science, and I mean there are some articles out there that uh, show that they are effective. Um, I would lean more on a IGR fly repellent rather than that, but uh, I there are lots of people that use them, and they do work for some people, and some people they don't. So I think that's kind of more of a place to place. If you think you're getting a good return on it, then it's not going to hurt the animal.
Next question. Why should I add Pastorella to my vaccination for my calves?
Uh, I think that's a very common um, BRD bacteria that we see, and whether you're marketing your calves through a sale barn or off the ranch, or if you're turning them out on wheat yourself, I think the best vaccine, the most modified live with Pastorella, as many BRD pathogens you can get in there, um, will help the next guy or yourself. And I think you'll be able to, most places you can advertise, that they've had this vaccine, and most guys would rather have an animal that has had that in their vaccine rather than not when purchasing. And I think you can get a little uh, more on the marketing end, as far as what your cattle are worth with a pastorella in them.
Do you recommend IDI's salt blocks to help prevent foot rot?
I guess I'm not totally familiar with the IDI, but there are, I think, as far as foot rot, we're not really supposed to say this, but there are, as far if you were to do a anaplasmosis control on a CTC in the feed, uh, I've seen that help with foot rot as well. Uh, that's that's an off-label use, but I think uh, if you want to control anaplasmosis, that's a way that can also help with a growth aspect and prevention of diseases that are responsive to tetracyclines. I don't If that's a salt block that has CTC in it. I know there's a bunch of brands out there. It sure can help, but it is off-label use.
And I don't know if I want to pronounce this correctly or not, but Altocid or Justify? Clarify? Thoughts?
Um, if it's a fly spray with a pyrethrin, I think that's going to be your best fly prevention. Um, there's not, we all probably know there's not a great fly product out there that is just it's going to work for everybody. But I think in my experience, if the pyrethrin is present, is the chemical are similar, uh, that typically gets the most response out of what your fly treatment. There's a lot of different brands out there, and there's a chloroform that works real well too. Um, but there's not a that's something that I think is lacking is a good fly control method. There's a million of them out there. But IGR is a great preventative, and then treatment. I think anything with a good insecticide in it, like pyrethrin or chloroform.
Do some fly killers also hurt dung beetle?
They should. Most of them should. And then start to see some grubs. Dewormers will help with that as well. Um, but yeah, they should.
Okay. Next question. How would I identify pneumonia and blackleg in cows?
Blackleg most commonly is you're going to see as a sudden death. Blackleg's a Clostridium disease that typically comes out of the ground. Cattle ingests it, and then I can't remember the prepaid. It's a couple days. They'll early on they'll go down or get real sore. And then within a couple hours, it's usually a sudden death. Um, it's caused blackleg because if you cut open the muscle, typically you'll see the muscle turns black. There are some antitoxins out there. I've seen one or two blacklegs present as down cows, and given antitoxin, I've never had a good success rate with it. That's a vaccine that I think every animal should get. Especially calves. It's especially with what cattle are worth. I think most can prevent a $2,800 death. BR, as far as catching that, that can be a little trickier. That comes into, most time head down, increased respiratory rate, snotty nose, ears down, typically just looking feverish and not perky. A lot of times off feed, not eating as much. And the BRD, that's we run into a lot, is are we recognizing the disease early enough, or are we finding that, we're given an antibiotic when we're already have 60% of the lung infected? It's going to be pretty hard to expect a good response out of a treatment of that. And so early detection's the best. And I think, with detecting BRD, a lot of that's, experience and looking at cattle, and figuring out which ones, early on sick. But a lot of times, ears down, head down, breathing harder than normal, cough, off feed, any of those are going to be your main signs.
Well, we'll give everyone another 30 seconds to type their questions if there are any more. And just as a reminder for everyone, if you do have questions that didn't get answered today, please feel free to email education@tscra.org, and we'll get those forwarded over to Dr. Thompson. That way he can help answer those questions if you have any more. But it does look like we've answered all the questions so far. So we just want to thank everyone who joined us for today's Ranching 101 webinar, and we hope everyone has a great afternoon and look forward to seeing you all on November 18th for our next Ranching 101 webinar. We'll be discussing soils to supplementation and the storyline of nutrition. Thanks for joining us today, Dr. Thompson.
Thank y'all. Thanks for listening to me.
Y'all have a good one. See you later.